Dr. Todd Ellerin, from Director of Infectious Diseases at South Shore Health. We're here to talk about COVID and not baklava, unfortunately.
But Doc, if you want to talk about baklava, we can.
Baklava.
Yeah, it's good.
All right, good to know.
So let's pick up the conversation here. At least 24. We've been talking about this. We talked about this in News Center 5 last night. We talked about it in this show tonight.
Yep.
At least 24 colleges in 15 states are reporting that students with COVID-19 and house parties are often being blamed for that. So how do we get people, not just young people, how do we get people to understand the precautions? And do you think that colleges need to do more to keep the students in line?
Yeah, this is a really important question, Eddie. I mean, I think that basically we know that as we open up schools, colleges in the United States, we're going to see cases. So I think the important thing for the young population to know is that they can get infected, and importantly, they can spread it to each other and to high-risk individuals. Also, remember, some of them are on campus right now, but how long will they stay on campus? They need to mask. They need to try to physically distance as much as possible, but when they're not, masking is even that much more important, and hand hygiene, the basics. Otherwise, you know, I don't know how long they're going to be actually physically on campus.
Well, at least for my son, he's going back to BC. He's a junior and he has to live off campus, but they are saying you need to have the mask. There's so many rules, and hopefully they listen, right? Massachusetts has a low rolling average of new positive tests, 1.6% lower. In some cases, I think it's 1.4, right, Ed, today?
1.4 was the last one, yeah.
Right. So that has a lot of people asking, how low does that rate have to go before some of these social restrictions are lifted? And where could we move on to this next reopening phase?
Well, remember, Maria, the next phase of phase 4, I think, is the new normal. So I believe Governor Baker said at one point we have to have an effective vaccine at that point, or at least what we feel is effective therapies. So it may be a ways away. But remember also, fall and winter are coming. We're going to be moving indoors. We don't want too many things to collide at once, or that could be a recipe for much more transmission.
Because many people are working on many frontiers. There's discussion out there about a chemical called oleandrin, which as I understand it comes from the oleander plant, and whether it could treat COVID-19. Is there any proof? And isn't the chemical dangerous?
Listen, importantly, we have to stay away from oleander. It is a toxic plant, okay? Under no circumstance should people be using it. It may work in the lab right now and have activity against COVID-19, but it has heart toxicity, cardiotoxicity. The risks way outweigh the benefits. This isn't even something close we should be talking about right now. Stay away from that.
Thanks for clearing it up, Doc. Really, thank you.
All right. Can you still hear us, Dr. Ellerin?
I can.
Okay,
I
good.
can, yes.
We can't see you, but we can still hear you. So we want to just really quickly say there is that FDA plan to give emergency authorization for using blood plasma as a possible COVID-19 treatment. That's been put on hold. That's the plasma donated by people, and we keep hearing stories like this. And this has been used for months now. So why all of a sudden does it need to have this authorization? Why is it on hold?
This is near and dear to my heart because South Shore Health does a lot with clinical research, specifically COVID-19 research. So here's the issue. Remember, the FDA wants to give the public medications that work and providers that are caring for the patients as quickly as possible. But they also want the science to be there so we know we have effective and safe trials. Think hydroxychloroquine. FDA gave that emergency use authorization before we had well-done randomized controlled trials. I think that probably is giving the NIH leadership pause, and they want to say, listen, the convalescent plasma from the Mayo study looks good right now, but we want even better clinical data, randomized controlled trials before they give it the green light. I think that's the tension.
Dr. Ellerin, great to have you with us. Thank you. Have a wonderful weekend.
Thank you, Dr. Ellerin.
Be well.
Be well.
Thank you.